I really, really enjoyed being the health officer in Howard County. Professionally, it was one of the most rewarding experiences I had.
It was wonderful. I enjoyed it. There was something new every day. You sort of had a plan for the day, but you never knew what would come in.
Once we learned what we needed to do, then like any good nurse, you just go ahead and do it.
Howard County has had a remarkable change in demographics, of course, over the 85 years, going from a predominantly rural farmland county to now a suburban and in some areas almost urban place.
In 1970, the census had been about 63,000. By the time I left, it was way over 200,000, so that's a major increase.
We served a population who was low income for the most part, very often immigrants or refugees.
So the biggest change, I think, for the health department has been to adapt to the changing population over time.
At the time that I started, the services had been included in Ellicott City. By the time I left, we opened a small office in Savage, and of course we did some services out in the western part of the county, so we really expanded.
When I first started in public health in Maryland, there were so many gaps in health coverage that the health departments were actually providing a lot of hands-on clinical services, maternity care, child health care.
When I came, Dr. Lazar had already gotten funding for school health aides in all the elementary schools. Children who were ill or needed something were not taken care of by the principal or the secretary in the school, but by a school health aide.
We've gone through so many transitions within the health department.
So there was an evolution that the health department became more focused on emergency response kind of activities, much more a 24/7, 365 operation than it had been.
One of the big things, of course, was the HIV/AIDS breaking out, a communicable disease, and a brand new one that nobody knew much about. So with a public health resident, I set up a program for all of the county health officers. It was a full-day education program that helped us to go forward.
H1N1 was a significant issue while I was there, and we were able to run the largest drive-through flu shot clinic in the United States, which was very successful, getting several thousand Howard County residents immunized.
During the past couple of years, we've had a number of emerging infections ranging from Ebola to Zika, pandemic flu. Each time we've been able to step up and get out into the community and provide whatever resources, treatment, or management to keep our community safe.
When you're doing public health well, the public doesn't generally see those efforts. So immunizations, trying to keep restaurants safe, offering health insurance to get you coverage to be able to get health care that you wouldn't otherwise have. It's actually contributing greatly to the health of the population.
As funding for health things have changed, there are fewer clinics that we do, and we do more administering of programs.
We did set up the Board of Health that is now standing. It was the county council when I got there, and County Executive Liz Bobo thought that health was important and we should have a group of people appointed to look with the health department at what are the problems in the county and what are the needs.
We also had a very large effort and developed a comprehensive community health improvement plan with lots of input from professionals and citizens in the setting of goals and objectives for the county.
And most recently, we've launched something that we call Care App, which is a platform that will allow all residents of Howard County to access services related to the social determinants of health. And this has the potential of reducing 40% of healthcare needs without ever stepping into a doctor's office.
It's been a real evolution of what health departments are doing.
Within Howard County, you have tremendous partners, from our police department to our fire and rescue to our philanthropy Horizon Foundation, who are all equally committed and dedicated to ensuring the health and safety of our community.
The county government was wonderful work for this county. I think they had a very open-minded attitude and was very, very respectful of the skills and knowledge that people with public health expertise could bring.
This place doesn't run just on nurses. It runs on secretaries, on clerks, on all kinds of support staff and nurses and social workers.
The health department, it seemed to attract a certain type of person who really did have a feel for people.
The 10 years that I've been here at the health department, I've had the honor of meeting many nurses who actually have worked within Howard County Health Department over the past 50 years.
I was impressed by the dedication of the clinical staff and the environmental staff particularly, because there are a lot of interesting issues in Howard County in public health that were not there for me in Baltimore City.
I've also had the honor of working with some incredibly smart public health leaders.
They really were interested in what they were doing and in the population that we took care of.
You can have a job and you can have compassion and you can have, you know it's the right job for you to do. That's what I experienced with working with this organization.
This celebration is really a celebration of the incredible people who over the past 85 years have worked for Howard County Health Department, making Howard County not only a healthy community, but a great community.